So you've been told you have fibromyalgia. It's scary. It's frustrating. In some cases, it may be a relief, finally knowing what's wrong and having a diagnosis. You may have just found out, or you may have been struggling with fibromyalgia for 30 years. In some cases, the pain is unrelenting, accompanied by fatigue, sleep disturbance, brain fog, and gastrointestinal issues, to name a few. Well, many people go undiagnosed for a decade or more. They're bounced around from one doctor to another. They're put on a variety of different medications, which for some people may give some pain relief, others no difference yet. Some people get worse from the medicines they're put on. They feel like guinea pigs. Life with fibromyalgia, for many people, is like a nightmare, but you don't wake up from it. I've worked with fibromyalgia patients for well over a decade. I've heard your stories through tears. I've seen the toll that it takes on families and relationships. I know that nobody seems to understand you. I've watched you fall through the cracks of this modern medical system, and I have been appalled. I want to say I am sorry. I want to explain to you within the next just few minutes in very simple terms why fibromyalgia is much different and more difficult to diagnose and treat than many other conditions. But first, let me just briefly introduce myself. I'm Dr. Mark Dailey. I'm a certified functional medicine practitioner, nutritional counselor, doctor of chiropractic. I have advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and advanced treatment of thyroid conditions. I have actually seen patients who have struggled with the very worst cases of fibromyalgia recover to live a normal life. I'd like to introduce you to some of those real people and give you a chance to hear their stories. But the truth of the matter is no two fibromyalgia patients are the same. Although there are shared symptoms, the specific symptoms of fibromyalgia differ in some cases slightly, in others dramatically. If you've been on any of the fibromyalgia forums, you hear some people complain of symptoms that you may not have. Many of them are shared, but they're all distinct, and each fibromyalgia patient is distinct and separate. They can't be treated by a label. Everyone is an individual. This video is not intended to completely dissect what causes fibromyalgia. My hope is that I can explain just one concept that will make sense to you and change the way you perceive this disease. Fibromyalgia differs from other diseases in that it is a multi-system breakdown. That is one of the keys. Multi-system breakdown. It's not like heart disease where you have a clogged artery. In that case, you can put a stent in. The whole disease is revolved around the heart, and treatment revolves around the heart. It's not like cirrhosis of the liver where the whole condition revolves around the liver or a single organ. Fibromyalgia, as I mentioned, is a multi-system breakdown. It involves the gastrointestinal system, the immune system, the adrenal glands, which are your stress glands. It involves your thyroid oftentimes. It involves your brain and nervous system, and even your emotions. Although your body is doing everything it can to continue to function, it's operating under extreme duress. That's why every day is a struggle. That's also why there will never be a single pill to cure fibromyalgia. The interesting thing about fibromyalgia and this multi-system breakdown is that not everybody breaks down in the exact same order. For some people, the straw that breaks the camel's back might be the thyroid. The thyroid breakdown starts a chain reaction that affects all the other systems. For other people, it could be the adrenals. The adrenals are triggered by many things, but emotions are one. That means the loss of a loved one or any emotional tragedy can be the straw that breaks the camel's back. What I'm saying is that the adrenals could be the starting point, if you will, in some cases of this multi-system breakdown. Now, in America, I see almost 80% of the time the gastrointestinal system as the cornerstone of this multi-system breakdown. The gastrointestinal system has direct ties to the immune system, the thyroid, the adrenals, the liver, the gallbladder, and yes, to the brain and the nervous system. So my intention is to keep this video short and to the point and introduce you really to the functional medicine approach to treatment of fibromyalgia. See, functional medicine addresses the underlying cause of disease using a systems-oriented approach and engaging both the patient and the practitioner in this therapeutic partnership. It's an evolution in the practice of healthcare that really better addresses the needs of the 21st century by shifting the traditional disease-centered focus of medical practice or healthcare to a more patient-centered approach. Functional medicine addresses the whole person, not just an isolated set of symptoms. A functional medicine practitioner spends time with his patients, listens to their histories, looks at the interaction between genetic, environmental, and lifestyle factors that can influence long-term health and complex chronic disease. And what better fits that scenario than fibromyalgia? If it's not a complex chronic disease, I don't know what is. Now, in this way, functional medicine supports the unique expression of health and vitality for each individual. Because functional medicine uses this systems-oriented approach, over the years I've developed a system that walks the fibromyalgia patient back to a state of health and wellness. But keep this in mind, I am not making false claims or promises. Every fibromyalgia patient, as I've already said, is different. Some have underlying autoimmune conditions that will always be there, but they can be managed with the right dietary protocols and, in some cases, pharmaceutical-grade supplements. Even those people can live relatively normal lives. Now, if what I've said so far makes sense to you, I want to make available a few resources. I put together a free video that actually reviews 3 separate cases from a functional medicine perspective. This will actually give you an idea how our approach is different than modern medicine. It's a free resource. Help yourself. I have a video on the 7 things you absolutely positively have to avoid if you have fibromyalgia. Also a free resource. Now, I've put together an extensive course which I highly recommend if you have fibromyalgia. It's the gastrointestinal system, the key to fibromyalgia treatment. This course takes you step by step through the process I use in my own office to relieve the symptoms of fibromyalgia. This is a powerful, life-changing course, which is actually very inexpensive. We also have a program called Functional Medicine, or FM House Calls, where I personally walk you through the process of recovery. Start with the free resources. If I can be of any help in the future, feel free to shoot me an email, call my office. But I hope this video has been informative and enlightening, and I pray that it serves you well.